There has been a new development in radiotherapy for prostate cancer. It's using a combination of two technologies, an MRI, which allows us to see the prostate and the cancer, and radiotherapy, which allows us to treat the prostate cancer. The first of these machines, which have been combined together, is called the MR Linac machine. One of the first in Australia was placed at St Vincent's, and I've been very privileged to be involved with Dr. De Leon in the treatment of almost 200 patients now over the last 2 to 3 years. The reason why I was excited by this new radiotherapy technology was it logically minimises the side effects of treatment of traditional radiotherapy. Traditional radiotherapy to the prostate is a little bit inexact in its treatment, thus damaging structures adjacent to the prostate, such as the rectum and the bladder. Logically, therefore, the two major side effects are bowel issues and urinary problems. In addition to these problems, erection problems also are a common outcome of this treatment. With the improvement of imaging with MRI and PSMA PET scanning, it's allowed us to see exactly where the cancers in the prostate are, allowing us to tailor treatments such as radiotherapy to increase the dose to the cancerous area and minimising the dose to structures which might cause side effects, such as the urethra and bladder neck. Since we began this technology about 3 years ago, our early data is suggesting indeed that is the case. Clearly, cancer results take up to 10 years to find, but the side effects of this treatment appear to be significantly better than the radiotherapy or traditional radiotherapy. Already, radiotherapists have been spacing tissue between the rectum and the prostate to avoid side effects in the rectum, but we're still stuck with the side effects of the radiotherapy affecting the actual urethra and prostate and bladder itself, and unfortunately the only thing that's really made a difference there has been this MR Linac machine. Already we're noticing less urinary side effects and a quicker recovery after the radiotherapy and less tiredness after the radiotherapy, which is a traditional side effect of all radiotherapy treatments. Some people aren't suitable for MR Linac therapy. People with 2 hip replacements, which can affect the quality of the MR, and people who need wider treatments of their whole pelvis, such as people who have spread to lymph glands, are not suitable for this therapy. As with every treatment we've introduced, we continue to collect all the quality of life and cancer outcomes in a prospective way to make sure that all of our data is evidence-based. So in 2023, many of my patients, particularly those over 70, are choosing to have this more targeted form of radiotherapy, which gives them a quicker recovery and less side effects and an equal, if not higher, rate of cure.